All right, what do we got?
Just came in. Heart attack. 5'9", 300 pounds, 32 years old.
How the hell does that happen?
Can I get a, Could be developing diabetes. You have to make a change. Oh, yeah.
You're graduating! Watch TV. You won't even have to leave.
You can't do this.
Yes, can I get a...
Yeah, no, deep dish.
You have to make a change. Good job, Jim. You got an A+.
Here are your fries, sweetie.
I still can't believe you give this child French fries.
I know, but it's the only thing that'll make him stop.
Thank you all for coming out. Are you guys excited about this lecture as much as I'm excited? This lecture, the Paleo Cardiologist, author Dr. Jack Wolfson. Great guy. He actually reached out to me this evening. He knows I'm doing a lecture on his book. Told me if you need anything, let me know. I'm very excited. Most of you guys know that I'm a big fan of the paleo diet. Diets could turn out to be a lot like religion. A lot of people think that their lecture or their diet's better than others, and this is not the kind of push everyone know, oh, this is, everyone's got to go paleo and paleo this and paleo that, but you're going to understand a lot of things about the diet and why it's so beneficial for heart health today. Dr. Jack Wolfson, a little bit of bio about him. He's a board-certified cardiologist with over 12 years in practice. He was a senior partner in a large multi-specialty cardiovascular group for 10 years performing angiograms, pacemakers, and cardiac ultrasound, and you guys will understand a bit of that as I go further through my lecture here. In 2012, he opened Wolfson Integrative Cardiology, a private practice where the focus is on nutrition, supplements, and chemical avoidance and detoxification. Dr. Jack was raised in Chicago where he did all of his medical training. We have something in common. Both of our wives are chiropractors. Following the lecture tonight, I'm going to do a question and answer thing. I always do question and answers for the people that come out. It's not recorded, so it's my gift to you guys. I'm going to follow this up next month. 2 dates, if you can make one of these. This is the paleo mini lecture in the office. I always cook a paleo dish with this. I'll explain foods that are paleo, that are not paleo. I'm in the dog house for picking this second date. I forgot that's my wife's birthday on the 25th there, so I'm a little bit in the dog house on that one. So the show must go on. I'm going to have to make that one up. And then for the people that want to follow this a little bit further, I'm going to do a weight loss challenge come March. This will be exciting. I'm going to use my buddy's gym to kind of do weigh-ins as far as weigh-in in the first part of the month and at the end of the month. I'm going to be running these blood works panels at the office here. The cortisol, the TSH, the sensitive 7, the candida antibodies. Some of you guys may have already ran some of these in the past. But looking at this, you'll understand as I'm going through tonight's selection, looking at certain parts of the paleo component where you're cutting out sugar, gluten, with the grains and dairy. You'll see on the panels I'm running with patients why it's beneficial and why I'm running certain panels to look at these things. My May lecture is going to be Drug-Induced Nutritional Deficiencies, HD. I've got a part 1 to this. It's time to do a part 2, and I labeled it HD because my first one wasn't recorded in great quality, so I'm going to ramp up the second lecture, and I'm attacking this very, very hard. My next 2 lectures are going to be very brutal. I'm not holding back anything, so I'm excited about this lecture. The next 2 lectures coming up, I got some good things in store. Big Pharma, Big Money. Drug manufacturers collected over $500 billion in revenue in 2013. For all that money, you would think that we're the healthiest Americans, or the health of Americans would be extraordinary. Yet the reality is much different. Shockingly, life expectancy in the U.S. is 34th out of 35th industrialized countries. Money's being made at keeping us sick. In 4 years, sales of ADHD drugs have grown by 89%. The abuse of these types of medications is astonishing. I just had a 5th grade teacher in yesterday, and she's a new patient, and I go, teaching's a challenge today, isn't it? She goes, yeah, you're absolutely right, it's a challenge. I go, how many of your students are on medications? She goes, I kid you not, when she said 1/4 to 1/3 of my kids are on medications. Going on field trips is not a blast anymore because I got a bag of medications I got to babysit these kids with. This is today's new normal. Doctors Group calls for a ban on prescription drug ads. The AMA on Tuesday called for a ban to direct consumer ads for prescription medications and implantable medical devices, saying that they contribute to rising costs and patients' demands for inappropriate treatment. Even the medical doctors are sick of you guys watching TV medication ads and telling them what you think you need. So in the United States and New Zealand are the only 2 countries in the world where you could do direct-to-consumer advertising. It's illegal in every single other country. This would be great if this passes through. I'm sick and tired of watching TV in the evening and seeing drug ads for certain things. It's just outrageous. It's criminal. The secret insurance companies don't want you to know. Insurers generally earn a profit by charging a premium on claims they pay, so you don't necessarily have an incentive to crack down on excessive spending. Obamacare's kicking in full stream 2016. People's premium rates are going up. We just had a few patients in this office this last week saying they're on lifetime medications for a certain thing, whether it's a heart or diabetic issue, where medications were only costing them $20, $30 a month, are paying $500 to $700 a month due to their price increase on their medications. This is the Affordable Health Care Act, right? You are what you invest in your health, not what your insurance covers. Here's my shameless promotion. Someone said that on one of my previous comments on a lecture there. You like what we do at Diverse Health Services, you can find our other lectures on YouTube. You could go to diversehealthservices.com and find the blog. You can find us on Facebook there. Find us on Twitter. We are everywhere. And we Skype with patients. Well, Dr. Jeff, I live so far away. How can you possibly help me through a computer? Well, this young girl, this is her mom, 66 years old. She's from Singapore, China. Shortness of breath, only at night, and has the need to yawn a lot. Zero shortness of breath during walking. She has some knee issues and all that going on. So I'm treating her over the computer. Her daughter has a heart of gold. Mom's on a bunch of medications and Coumadin and that kind of stuff, and she's got the shortness of breath, and daughter's just searching things out, came across our YouTube stuff. It's like, hey, you know what, maybe they could help us out here at Diverse Health Services, and you know, maybe we'll do something else outside of the medicine here. All I did was our general artery cleaning program with her. I put her on an artery cleaning regimen, and 2 months later, zero shortness of breath. I was working with her knee pain. Her knee pain's improving. Her doctors don't like me because she wanted to get off warfarin, which is the Coumadin. And I told her, you've got to work with your doctor to get off that. I can't take you right off that. But with her numbers improving so much, she's off all of her medications. And I just got off a Skype appointment with her yesterday, and her glucose and A1C have come down dramatically off all her diabetic medications. She's on 0 medications now when she's on like 5 or 7 different medications. We ran clotting factors on her that you can kind of see at the bottom here, and I'll get more in depth with that as we go further through the lecture here. She had a history of a stroke, so we're running a little bit more in-depth analysis with their blood to kind of see if we could trace back what's going on with some of that stuff there. Males 40 years and older. I want you guys to pay attention to this right here. Low testosterone, erectile dysfunction. This gentleman was on testosterone patches for 3 months, zero help. He wanted a different approach, heard about our office, came to see me, put him on some stuff to support him. I was like, you know, I think there's something more going on, and I think something's being missed. He goes, oh yeah? I'm like, yeah, I'm going to give you a blood panel that I want your doctor to run because something's being missed. He goes, what do you think's being missed here? Well, I told him the arteries to the penis are smaller than the arteries going to the heart. You will plug up your penis before you plug up your heart. So he ran a panel, which was like pulling teeth with his doctor to run, and this is what came back. His lipoprotein A was through the roof, C-reactive protein was through the roof, his homocysteine was elevated. 3 out of the 4 came back high. His doctor scratched his head and goes, maybe I ought to look more into this because your cholesterol looked fine, but yes, there's definitely a problem here. I've personally had to have patients have strokes in front of their doctor before they would run a panel. We use LabCorp, so we could have patients run blood work around their doctor, but some patients want to save some money and use their insurance. If they use their insurance, they have to go through their medical doctor and run that panel, and some are a little bit reluctant to run it, but this is what comes back with a lot of these. I'm going to explain these factors as I'm going through this lecture here. The cholesterol scare. I trust my heart to Lipitor. Everyone's so brainwashed and scared about cholesterol and thinking that they need their cholesterol lower. I'm going to teach you guys about the benefits of having high cholesterol. Benefits of high cholesterol. People with high cholesterol live the longest. Consider the finding of Dr. Krumholtz of the Department of Cardiovascular Medicine at Yale University, who reported in 1994 that old people with low cholesterol died twice as often from heart attack as did old people with high cholesterol. More cholesterol as you get older is more beneficial. You don't want to artificially lower your cholesterol. High cholesterol protects against infection. Many studies have found that low cholesterol in certain respects worse than high cholesterol. For instance, in 19 large studies of more than 68,000 deaths reviewed by Dr. Professor Jacobs and his co-workers from the Division of Epidemiology at University of Minnesota, low cholesterol predicted an increase of risk of dying from gastrointestinal and respiratory diseases. You look at people with Crohn's and ulcerative colitis disease, a ton of them have low cholesterol. Your immune system needs fat. I've had patients that I've Skyped with from New York, the cholesterol 130, their immune system's tanked, they can't fight off a mono infection, and I'm not here to bash other diets and that kind of stuff, but she was vegetarian. I told her you need more fat and cholesterol in your diet. You need your cholesterol up for your immune system to go after big infections like this, and you'll never get over certain things if your cholesterol's at a low level like this. Mortality, cholesterol and all-cause mortality. Our data accord with previous findings of increased mortality in elderly people with low serum cholesterol and show that long-term persistence of low cholesterol actually increases the risk of death. Thus, the earlier patients start to have lower cholesterol concentrations, the greater risk of death of all causes. Continue to lower your cholesterol, you'll die earlier of all causes. Brain health. People with the highest cholesterol levels had the best memory. Your brain is 60% fat. You need cholesterol for your brain. Artificially lower your cholesterol, which everyone's doing because they trust their heart to Lipitor, and this is all your dementias and Alzheimer patients as you're seeing as of today. More on brain health. Another report concluded people with low cholesterol had higher rates of depression, aggression, and suicidal thoughts. You think your brain needs fat? Cholesterol and cardiac events. People with low serum cholesterol, less than 180, have 3 times the incidence of stroke as the general population. People with low cholesterol, lower than 200, suffer nearly 40% of all heart attacks. I've had 3 patients in the last 2 weeks that have heart attacks not in the office, but patients at our office, and their cholesterol was below 200. One was below 150. So you really think this is a cholesterol issue? This is an advanced screening test that we start doing at the office. This is the VAP screening. If your doctors aren't running VAP screening, they are behind on the game. Our neighbors at Dr. Cassidy's office are running this for us, and we can use people's insurance to run this as well too. If not, they got good cash prices for it. And on the east side, Dr. Margol's office is running it for us too. Out-of-state patients, I don't have remote offices just yet for the VAP screening. The VAP screening measures the lipid particle sizing of your LDL and your HDL and does a little bit more in-depth analysis with other clotting factors, as I'm going to break this down as well too. I actually went to a doctor's learning night with this. It's interesting because it was put on by the VAP panel company, Athrotech, and it was sponsored by a pharmaceutical company. So the first half of this, I'm at a steak restaurant, fancy steak, seafood restaurant, getting paid by a pharmaceutical company. I'm just kind of just in the back, just shaking my head. So the first half was the VAP screening stuff. We learned about that. The second half was the statin portion and all the people pushing statin medication and the skewed literature of, why you need a statin. Let me tell you the future of where this is going to go. And mark my words if I'm wrong. In 10 years from now, whether your blood work shows that your cholesterol's in or out of range, they will want you on a statin for preventative measures. This is the direction statin medications are going, and this is why Lipitor is the highest revenuing drug in the United States. So let's break down a panel here on someone. This gentleman came in, and he's actually in the crowd here tonight. His cholesterol is about 299. LDL was 219. Breaking down the density size of the LDL, there's buoyant LDL and there's dense LDL. Buoyant LDL floats, and that gives you more of the density pattern A, which is good. If it's B and it's dense, that will plug you up. His is good. Based off this page here, his cholesterol is not an issue, being at 299. That's not going to create a problem. You go further through this screening though, lipoprotein A was very elevated. MTHFR mutation. MTHFR mutation, you will not process folic acid or folate, and I'll get into that further. And if you don't process folic acid or folate, homocysteine levels tend to climb. So C-reactive protein and the homocysteine was high. So if I gave him folic acid or folate to try to lower that homocysteine level, that level will not drop because he's got the genetic mutation with the MTHFR that he does not process that folic acid. High C-reactive protein, high homocysteine, very, very high lipoprotein A. Family history, his mom's heart literally exploded. He's in the crowd and he'll verify that. Well, let's talk about what's going to plug you up here. LDL. The LDL, the amount of bad cholesterol carried by the LDL particles ranges up to 130. They're even dropping these ranges down. They're dropping these ranges down just more so they could get people on statin medications. You'll see these new ranges going up to just about 99 or 100. And same thing with blood pressure. They are saying, well, blood pressure needs to be lower and lower now. And we thought 120 over 80 was normal, but now 110 over 70 seems about the new normal, and we should get more people on blood pressure medications as well too. Breaking down the LDL, pattern A, pattern B. Buoyant floating LDL is what you want. It's the pattern B that's small and dense that's going to plug you up. The VAP screening rules out which pattern that you have. High carbohydrate diets will create more small dangerous LDL particles. Good fat, good protein, low carbs and sugars will give you the non-dangerous LDL. Triglycerides, on a scale of 0 to 150, this is another type of fat in the blood that comes from too many carbohydrates, sugars, and bad fats in the diet. This is dietary manageable. Elevated blood levels of triglycerides are associated with increased risk of coronary artery disease. Triglycerides will plug you up. Too many sugars in the diet, carbohydrates, and these things will plug you up here. Cholesterol runs high in my family. I'm proud to say I have high cholesterol. I'm going to live longer, right? So looking at the triglycerides, I've talked about previously in my lecture, I've had them up to about 700 before, realizing, crap, this runs high in my family, and in doing a paleo-based diet, and in 1 month, got mine down from 700s down to low 100s in 1 month, just by doing simple dieting stuff. I increased my oils and used certain B vitamins that had some lipotrophic factors in it as well too, but the paleo diet was one of the big factors that helped contribute to this. Lipoprotein A, this is probably the nastiest factor that patients could deal with here. Lipoprotein A is a genetic clotting factor which is like likely a major factor in aggressive blockages. LPA particle easily oxidizes, crosses the endothelium of the blood vessel and increases inflammation, and ultimately leads to blockage and plaque rupture. These are people that get the stents, shunts, bypasses, and they plug those types of things up or have early issues with the heart. This is something that you are not going to diet and exercise out of your system. This is a genetic factor, and this is probably one of the nastiest ones to deal with. And you better work with the right doctor in knowing how to manage that lipoprotein A factor. C-reactive protein is high with infection and inflammation. So you got inflammation in your arteries. This is your big precursor, and this is important because you look at the normal artery, inflammation is the precursor to plaque form buildup within the artery. So that's a good indication if something's going on in the artery and inflammation is going on, what's creating that inflammation. You want to find out because that's going to be a problem there. MTHFR mutation, this is just what I was talking about here, the enzyme necessary for the methylation component of the folic acid. And if you're not breaking down that folic acid, homocysteine levels will climb and glutathione levels will drop. That's an antioxidant in the body there. Those of you who want to look at the chart there, there's the folic acid cycle. People will miss that gene. Homocysteine will rise, glutathione levels will drop. Is ADHD genetic? Many people believe ADHD is genetic. Often when a child is diagnosed with ADHD, a parent or parents will realize they also have similar symptoms. There often seem to be someone else in the family with symptoms, if not an official diagnosis. So is there a gene responsible? They have been correlating the same genetic mutation with kids with this MTHFR factor. The Human Genome Project, completed in 2003, discovered that the gene mutation MTHFR was defective in some people. I've been running this on some of the kids as well here too. I've had a few that I found this on. It's interesting, kind of find, and not processing that folic acid and folate and having issues with this whole ADD, ADHD. And it's a big topic and subject. 80% of the kids with that diagnosis, I'm going to go in these schools, protein shakes, high doses of essential fatty acids and B vitamins, and fix 80% of them just with simple stuff like that. All the ones, you got to rule out the parasite stuff, you got to go after heavy metals, you have to take a very diagnostic approach to these brains today. Homocysteine. Most scales will show 0 to 15. This is another factor that will plug you up and you want this under control. We don't like to see that above 10. I've seen people personally have problems on 11s with heart attacks and strokes with this right here. Homocysteines correlated with dementia, Alzheimer's, pregnancy complications, diabetes, osteoporosis, all your other cardiac factors and strokes and all that stuff. You think this is important to run? Absolutely. Why aren't your doctors running it? Because there's no medicines in Lipitor that's going to treat this kind of stuff here. This is all food and nutrition and the right factors to go after this. And if you have a high homocysteine level and the folic acid and traditional things aren't helping lowering that, then you got to look at that MTHFR factor and make sure that's not a problem. Fibrinogen is another factor here. It's a protein produced by the liver. This protein helps stop bleeding by helping blood clots form. You can kind of see in a picture how the fibrin creates a little net. So if you cut yourself, it creates that little net and kind of blocks it and prevents you from bleeding out. Some people produce higher levels of fibrinogen, and that higher level of fibrinogen can create plaquing and more or less the clots in people. Synthetic estrogen in cardiac events. The present review assessed the effects of using hormone therapy for 6 months or more. 19 randomized controlled trials compared oral hormone therapy with placebo. Most participants were from the United States, and mean age in most studies were over 60 years old. The conclusion of this study: in postmenopausal women, hormone therapy increased the risk of stroke and obstruction of a vein by a blood clot in these individuals. Hormone replacement therapy in women will increase the rate of heart attack, stroke, and cancer. Now you're seeing more issues with guys doing testosterone treatment and having the same problems. Synthetic hormones are creating blood clots in people as well today too. So you gotta be aware of this. Teaching doctors about diet and nutrition and diet. Your doctors do not know anything about nutrition. In the mid-1980s, the National Academy of Sciences published a landmark report highlighting the lack of adequate nutrition education in medical schools. The writers recommended a minimum of 25 hours of nutrition instruction. Now, in a study published this month, it appears that even 2.5 decades later, the vast majority of medical schools still fail to meet the minimum recommended 24 hours of instruction. This is 2010 here. This is where they lack trying to treat patients from nutrition and want to treat everyone like they've got a chemical deficiency today. So why paleo? Let's get in this here. What are the big 3 things about the paleo diet that make it beneficial? You cut out your sugars, you cut out your grains, and you cut out your dairy. That's the big 3 things with the paleo diet. The Paleo Proof. In 2009, a study compared the paleo diet to a diabetic diet. The paleo group was advised to avoid all dairy products, all grain products, including rice and corn, and all legumes, including peanuts, and all sugars except fruit. The results were impressively in favor of the paleo for improving blood sugar, triglycerides, and raising HDL. Blood pressure, weight loss, and weight circumference were better in the paleo group. No dairy. No science exists to support the relationship between milk and bone health. The United States is one of the biggest consumers of dairy products, yet has the highest incidence of osteoporosis. On top of that, bovine growth factors, steroids, estrogens, antibiotics. You will not lose weight eating today's dairy with what's in today's dairy. This has actually been pretty interesting. I've talked to a few guys in the audience here even about this with myself. I always consider myself kind of doing a little bit more Swiss paleo and incorporate some dairy components. And beginning of the month I was like, man, let me really assess how much dairy I'm actually doing. I'm looking, I'm like, I'll do some creamer and coffee, I'll do butter, I'll do some ranch, I put cheese on everything, and I'm doing 2 whey protein shakes a day. I'm like, holy crap, I'm doing a lot of dairy. Well, you know what, let's completely cut it all the way out. I kid you not, where I kind of was trying to break through my own personal plateau. 2 weeks ago, I completely cut it out. I dropped 3 pounds in a matter of 5 days cutting out my dairy. I've always talked about, I knew I was milk and dairy sensitive because milk and ice cream always plugged up my ears and throat, and strep throat, earaches, always had problems with dairy. I just didn't know I was that sensitive, and I'll be running my sensitive 7, and this is why we're looking at these things on people's blood work. This is a 44-year-old lady. She had left side pain and some kidney issues. She had stomach bloating and gallbladder problems. Fixed up her gallbladder. I ran some blood work in a sensitive 7 with her. She had acid reflux on top of everything as well too. She lit up the whole entire panel here. Corn, peanut, soy, all your dairy antigens here, gluten, egg, and it also had high candida. This is what leaky gut looks like on a blood work, and hypochlorhydria, low stomach acid. By definition of a food allergen is an undigested protein, and you need acid to digest your proteins. So if you lack adequate hydrochloric acid, you won't digest these food allergens, and this will create gut inflammation. And some people in that gut inflammation, you might see that C-reactive protein even high in your blood work, as well as weight gain, because this will kind of increase cortisol in some individuals. This was a follow-up with her as about 3 weeks after. Her reflux was gone, her gallbladder was fixed. She lost 10 pounds in a few weeks. I had a follow-up with her just a week or two ago, a few weeks ago. She's down 20 pounds in a matter of 2 months, just with the dairy. Fix up her gut, working with the leaky gut component. You gotta use certain enzymes and components to work with the leaky gut issues and eliminate these things off the gut to give the gut a rest as you're healing it up. And some things, if they're not as high, you could reincorporate back in the diet, but if they're really, really high, like the dairy or gluten, sometimes we'll just keep them out and patients do better off them. Now the gluten component, wheat, barley, rye, oats, corn, etc. are grains that are needed to be heavily processed to allow for human consumption. Grains are heavily promoted by corporations because they are cheap to manufacture and boast a long shelf life. It's estimated that 50 to 70% of the population is gluten intolerant. And I'm here to tell you today, I would say it's closer to 80–90%. From tests I ran with patients, it is higher than that. So if you're gluten intolerant, because these genetically engineered foods and wheat are wreaking havoc on our gut, that's going to create gut inflammation. Your C-reactive protein might go up, your cortisol might go up, that might create weight gain issues. These are all the beginning of an inflammatory process with people here. Cheap food will cost you in the long run. The highest rate of obesity and diabetes in the United States are found among the lower income groups. The observed links between obesity and socioeconomic position may be related to the dietary energy density and energy costs. Refined grains, added sugars, added fats are among the lowest cost sources of dietary energy. They are inexpensive, good tasting, and convenient. In contrast, the more nutrient-dense lean meats, fish, fresh vegetables, and fruits generally cost more. Eat cheap, it will cost you in the long run. Think eating cheap is bad, price out cancer today. I cannot tell you the amount of young people and the amount of adults just coming in with cancer in our office lately is just scary. We live in a world, the food, the water, the air, everything's polluted today. Our whole environment promotes cancer. You want to eat clean as possible as you can. This kid, I kind of cropped out the age. I believe he was about 10 years old. Wets the bed here, hyperactive, had an issue of blinking and kind of scrunching his face a bit. That was all calcium issues, calcium deficiencies with that. The hyperactivity, he had a lot of gas, bloating type problems, a lot of gastrointestinal issues. We got him on the paleo-based diet. We look at his blood work here. He was high on all the dairy components, gluten we cut out, and I'm finding candida on a ton of people, all the antibiotics, the steroids, birth control, hormone replacement therapy, issues with hepatitis B shots are creating a lot of issues with yeast with people too, and a lot of gastrointestinal bloating with this. So we put him on a paleo-based diet, and it was very cool because all his gastrointestinal issues went away. His bedwetting completely decreased there. And he's absorbing that calcium better as well too. It's people that will have low minerals and low iron issues with malabsorption problems because that gluten is like a pasty urethane on the gut, which will create malabsorption issues. But a lot of his symptoms went away, and his mom was pretty impressed with how well he was turning the corner with things here. This is a diagram that just kind of explains a little bit of the leaky gut stuff. So antibiotics, infections, enzymes, other drugs, medications, your NSAIDs, ibuprofen, Motrin, Tylenol, all these things will destroy your gut. Food particles will get in. You'll build antibodies to those things, and then your immune system attacks your gut and creates that inflammation. If you do not heal your gut, if you cannot heal your gut, you will not heal any health alignment you have, period. 80% of your immunity is through your gut. You must be aware of the GMO foods today. These are things that are wreaking havoc on today's guts. All the Roundup Ready foods, all these things are not recognized in our gut and creating issues with leaky gut components and more gluten intolerance components, and this is why you'll see more weight gain issues as well too. Big issues with the GMO foods. I highly suggest you start being aware of this food list. You look at the Roundup Ready components and how's this going to affect someone's heart and inside the body. This increases lipid peroxidation, increases blood stickiness, damages the vascular endothelium, blocks mineral absorption, increases ammonium, decreases amino acid production, increases risk of dangerous gut bacterial infections, leads to formaldehyde production. This is all just from the Roundup. Well, we've known about pesticides forever in general. These are all the things that all the pesticides are correlated with: dementia, Parkinson's disease, cancer, diabetes, hormonal abnormalities, asthma, birth defects, heart disease. We talked about hormonal abnormalities all the time. All the pesticides, herbicides, fungicides, plastics, all these things mimic estrogen. All these estrogen mimicking things are affecting everyone on some type of age range. This is going to be the prostate cancers, breast cancers. This is going to be fertility problems today, gender bending issues, early puberty issues. On some type of age range, everyone's being affected. If your detox pathways are blocked, these things will create problems with you.
Most of what is grown today is treated with pesticides. That's not so healthy for the environment, but does it really affect us? Meet the Palmböck family. They don't eat organic food.
Det kostar mer än vanlig mat. Det blir en stor skillnad när man är många i en familj.
But for the next 2 weeks, the Palmböcks are going to eat only organic. Before they begin, urine samples are taken from each of the family members. And it turns out they have a number of different pesticides inside their bodies.
Vi hittade framförallt insektsmedel, svampmedel och stråförkortningsmedel.
Vi äter insektsmedel.
Ja, äckligt.
Ja.
So, everything in the kitchen is replaced, and they begin eating only organic. Then, another round of samples are taken, and now, almost all the pesticides have disappeared.
Vi vet ju väldigt lite om långtidseffekter av att äta mat som har besprutats. Speciellt med tanke på att studier har visat att kemikalier i kombination kan vara långt farligare än kemikalier var och en för sig.
När man får höra det här så tänker man framförallt på barnen. Det är många kemikalier som har lämnat deras kroppar och jag vill inte ha tillbaka dem med mina barn.
No sugar. This is the biggest thing with the paleo component in your heart health. Sugar causes cardiovascular disease. In fact, those people who ate the most sugar faced an increased death rate of 250%. Studies show diabetes are at 3-fold risk of heart disease, cancer, and dementia. If you are labeled pre-diabetes, your risk of dying from heart disease is 60% higher. Now, there's other holistic cardiologists, and they like to preach raw foods and vegetarian-based diet, and that's all great too. But I will see a lot of vegetarians be more carbohydrate-atarians, dessert-atarians, sugar-atarians. This is the beginning process of inflammation in the body, and all that glucose in the body spins that cycle. So this is why always high, good fat, low sugar diets, good fat, good protein, low sugar diets have always helped people. We kill, the standard American diet kills this middle pathway. We increase that glucose in our body. If our body can't process all that glucose, it's stored as triglycerides, and that's how triglycerides start climbing up on a lot of people because of the excessive use of the glucose. Your glucose goes up, your hemoglobin A1C goes up, all those pre-diabetic factors. And if you spin this cycle, weight gain in that pre-diabetes is how this stuff all begins. Spin that cycle and the weight gain in the pre-diabetes just follows that. These are your factors that defines insulin resistance. If you have increased cholesterol, low HDL, high HDL, increased triglycerides, increased glucose, hemoglobin A1C, insulin, this is that pre-diabetic cycle. You are getting too many sugars in your diet. Hidden sugars, even too much fruit daily will drive these up. Drug-induced diabetes, statin medications, Lasix, beta blockers, steroids, these have all been known to push people diabetic. So all the Lipitor is creating all these issues as far as pushing people diabetic, stealing the fat from your brain, muscle aches, joint pains, and yet does the literature really support statin use for heart attacks? Not by much. Other drugs like aspirin and some other ones will create some increase in blood sugar within the blood, and then there's a few other medications at the bottom that has been known to create permanent diabetes. But these four up top here have well been known to kind of push people diabetic. And I've had patients that we've worked with getting them off certain medications, and without them trying anything drastic with their diet and getting off certain medications, their glucose numbers decrease. That's what you'll see with certain beta blockers and steroids. It will shoot up your sugar numbers pretty quickly. Statins, because we haven't talked enough about these, right? A study released in 1998 was a primary prevention trial with over 6,000 participants without any known heart disease. Half the group received the statin drug, pravastatin, and the other half a placebo. The earth-shattering difference between the groups regarding cardiac events was 4.9% in the drug group versus 6.4% in the placebo group. That's a 1.5 difference after 5 years of taking the drug. Another way of looking at that data is 63 people need to take the drug for 5 years in order to prevent one person from having a cardiac event. That's not too good, is it? Dr. Wolfson talked in the book, I believe he said maybe 1 out of 500 people may benefit from a statin use. The majority are having issues of being pushed diabetic, muscle aches and pains, and other complications along with that. Dr. Brownstein had a great book, came out about a year and a half now, I believe, The Statin Disaster. If you want to talk more about the statins or get more involved with that or just need more literature and research, you check out that book. Blood pressure medications. Let's attack the medications here. Most trials concluded blood pressure drugs do not lower the risk of heart attack. 2014 trial found no reduction in heart attacks among patients on antihypertensive medications. Well, what about strokes? Strokes were an endpoint to the above trial, and the drugs did work. Stroke risk decreased from 5.5 to 5%. So still not that much of a decrease, but it actually did help with the stroke components. There are certain areas where the blood pressure is elevated to be concerned, but once again, you want to know why the blood pressure is going up. A lot of times, sugar and pre-diabetic factors will drive the blood pressure up in a lot of people. Your blood pressure is a lot more reactive to sugar than it is to salt. A lot of people get scared about the whole, oh, gotta stay away from salt because it's going to drive up my blood pressure. It's not a salt issue, it's a sugar component. If you could cut out your sugars, it will make a big difference, and you'll change the blood pressure around. Aspirin. At least 15 people die of gastrointestinal bleeding for every 100,000 who take aspirin. On May 5th, 2014, the FDA banned Bayer from recommending aspirin for the primary prevention of heart attack and stroke. People are taking this for daily prevention. Nothing in the literature supports doing aspirin for prevention of heart attack and stroke today. Nothing. Gastrointestinal bleeding, pancreatitis, gastritis, inflammation of the stomach. These are all the things, and bleeding is all what these blood thinners and NSAIDs are doing to people today. Let's get a little bit more into the aspirin. Aspirin has been linked to eye blindness. Regular aspirin users are more likely to develop the wet form of age-related macular degeneration compared to people who rarely or never take the drug. Ringing in the ear. This has been linked to ringing in the ear with patients. Tinnitus is often associated with hearing loss. Aspirin potentially effect on hearing was first reported soon after the drug was synthesized more than a century ago. This will tear up your hearing. This will wreck your vision. Aspirin, nothing supports aspirin. You want to use more of your natural blood thinners, your fish oil. There's other components that are more aggressive, your ginkgo, your bilberry. At the right doses, you'll get the same benefit of the blood thinning component. And I tell you, if you've got one of those aggressive factors like a lipoprotein A, you better know how to play those properly as well too. Other blood thinners. Plavix is effective in keeping stents open for the first year only. So if you have a stent, Plavix is only effective in keeping that open for the first year. After that, little data supports any benefit to continue on aggressive blood thinning. In fact, a recent study found those who continued on the class of these drugs, which include these ones here too, for more than a year had a higher risk of death. Most of these people are on blood pressure medications, they're tired, they're lethargic, you slip, you fall, you hit your head. That could be a brain bleed, and that could be very devastating for someone. Coumadin. Coumadin is extremely overprescribed and only benefits those with the highest stroke risk. Stroke risk for the majority of people on the drug is reduced from 4% to 2.5%. Bleeding on warfarin can be catastrophic and deadly. Now here's an important thing, because people on Coumadin can't eat your leafy green things and the vitamin K stuff. They can't eat anything with the vitamin K because it interacts with that. Without vitamin K, calcium deposits everywhere in the body, including blood vessels and the coronary plaque. Coumadin inhibits vitamin K activity and is linked to osteoporosis and accelerated coronary calcification. You will plaque up the arteries in your heart faster on Coumadin because of the lack of the vitamin D, or the lack of the vitamin K component. Pretty interesting, isn't it? Drugs for heart rhythm. Antiarrhythmics are commonly prescribed for palpitations. Symptoms such as heart racing, skipping, and thumping. In 1992, a study was published looking at patients with a previous heart attack and suppressing their PVCs. The trial, known as CAS, found those taking the active drug died at 3 times the rate as the placebo. A lot of heart arrhythmias, fast heart rate, weak, irregular, slow, respond very well to nutritional regimens. A ton of people are deficient on your B vitamins, your magnesium, other key components in the body, and I treat this stuff on a weekly basis. We could go around the room here and feel people's pulses, and I'm sure someone would have a little jump in their pulse. And it's interesting, you know, medications is just kind of a band-aid treatment. You want to go after the nutritional component first. Electromagnetic EMF issues, and I've always said EMF and GMOs are the new animals of today. There are plenty of studies that demonstrate how EMF negatively affect the heart in such ways as increase or decrease heart rate, decrease heart rate variability, increase arrhythmias, increase heart cell free radicals, decrease heart cell glutathione. Your heart is an electrical organ, very electrical sensitive. If you're being bombarded by all this EMF, it could throw off your heart's rhythm. You watch people that wear these walkie-talkies up on their chest or put their cell phones in their pocket. That could potentially affect your heart and throw it off rhythm. Diabetic medications. A trial called Accord looked at the issue of intense blood sugar control in patients with type 2 diabetes. The author found a 22% increased risk of death in the group with the best blood sugar control. Bottom line is that drugs designed for reducing diabetes and high blood pressure do not necessarily lower the risk of cardiac events. I ran this test. This is what I'm considering one of the best bang for the buck tests that I've been running with patients as of lately. It's the organic acids test. If you're interested in this, I'm going to kind of run through mine and I'll explain what I was checking here. At the office, you could get a kit from me and we could run this. It's all urine based, so you just take it home, catch a urine sample in the morning and send it out. Most insurances, it'll just be $190 out of pocket. If you don't have insurance, it's $369. And I've been running this with some Skype patients on some very difficult cases that we've had some issues of turning a corner with patients. So this is mine here, and these are different things that it checks here. Looks at fatty acid metabolism in the body, looks at carbohydrate metabolism, your energy markers, your B vitamin markers, methylation factors, neurotransmitter components, oxidative antioxidant markers, detoxification markers, bacterial infections, yeast infections, germ imbalance within the body. This is a very, very cool test, and this front page was just a little bit of a summary of what was low on mine, so I'll kind of break this down here a little bit. You look at your markers, and coloring is a little off here, but you'll see green, yellow, and red in your markers here for fatty acid metabolism, your carbohydrates. When I say patients, the top 3 deficiencies on patients are zinc, magnesium, and your B vitamins. I don't make this stuff up. This is how I prove it. This is what everyone's deficient on and why they're having such problems that they're having. And these are your B vitamin markers, and I'm fatigued, I'm all tired, I have no energy. This attacks your energy pathway and looks at your energy pathways here. Energy markers as far as your CoQ10 amino acids and other B vitamin components, and a little bit more in depth with the B vitamin complex more individually. I just ran this with a Lyme patient. I will show her results at my following lecture here. She had the methylation factor here, so how we kind of looked at the one gentleman with the heart issue, and we found on blood that he had the MTHFR factor. You could find on this one if you have a methylation factor and aren't processing that folic acid as well too. Neurotransmitter markers down below here, oxidation markers. Now here's the cool component. This checks your detox pathways. If your detox pathways of your liver are blocked, you're going to see it through here as well too. Fungal yeast components, and on my Lyme's patient, she had the methylation factor going on here. Her detox markers were completely blocked. Her liver was blocked up with that. She had a fungal or a yeast infection on top of that as well too. So we found some very cool things with her just from a simple urine-based test. And then at the end, it gives you a very cool analysis. So you get like what's in a typical multivitamin, and then this is what's recommended based on my test here. Vitamin C, E, magnesium, and selenium. So a lot of these are antioxidants. A lot of my antioxidants were low when I was low on magnesium. Yeah, it's like, that's interesting. I take a ton of antioxidant components with my green shakes and all of that. I was contributing it to exercising and over-exercising possibly at the time that drained my antioxidant levels. So very cool test that checks a whole bunch of different things for a good price there. This is great. Everyone buckle their seats. Now we're going to really get into the meat of the paleo book here. Stress testing. Stress testing is an excellent way to determine if a person's symptoms are heart-related. Stress testing is a huge moneymaker for the cardiologists and hospitals. Preoperative stress testing are usually worthless, and avoid nuclear imaging, the thallium stress test there, as they are often falsely positive and may lead to unnecessary angiograms, which are the heart catheterizations. Stress testing in general is a great test, baseline-wise. Don't go for the nuclear stress testing. That dye, I personally seen irritate people out big time as far as affecting their kidneys and driving their kidney numbers crazy on their blood work. On top of that, there's a lot more false positive with that chemical stress tests. The hospitals that perform the most stress tests also do an enormous amount of angiograms and stents, if that tells you anything. This is, and I love this part here because I can tell you all of this because I'm speaking through the words of another cardiologist who's already been here. This is what he's telling you guys. CT scans for your calcium score on your heart. Will a high or low calcium score change the therapy of the average cardiologist? Absolutely not. What will they do? Probably increase your statin use. A 2004 study found those patients with a high calcium score but no other risk factors did not benefit from statin drugs. So calcium CAT scan scores will lead to more unnecessary tests such as stress testing and angiograms. Why are they doing it? Follow the money. Dr. Wolfson says follow the money. It's a big money maker for the cardiologists and fills up their pockets with money. It's not going to change if you have a high or low score how they're going to treat you. This is just more statin medication. And on top of that, the amount of radiation exposure you're getting from this test here is through the roof. Angiograms. When you're in the midst of a heart attack, an angiogram heart catheterization is a great test for it offers therapy in the form of angioplasty and a stent. A heart attack is the only situation where stents save lives. Unfortunately, heart caths are needlessly performed thousands of times per year on patients who never had a symptom in their life. Heart caths also carry the risk of radiation exposure, stroke, kidney failure, and death. Always think nutrition first. Why are you plugging up? You want to look at your factors and your heart factors. You want to look at the VAP screening. You want to know what's going on inside. You just don't want to treat someone saying, oh, your cholesterol is above 200. You need to be on Lipitor, drop your levels, and it doesn't matter. It's not a cholesterol thing. And I could show you charts of people with the heart attacks with cholesterol below 200. It's not a cholesterol factor. You got to look at the genetic components. You got to do an overall assessment, and you got to look at that VAP screening. It's very important. Stents. Stents are for symptoms and do not prevent heart attacks or save lives. A study done by the New England Journal of Medicine divided groups of patients with cardiac symptoms into two groups. One included stenting and the pharmaceuticals, and the other one only with pharmaceuticals. The results revealed stenting did not prevent heart attacks. In fact, the stented group had slightly more heart attacks. Stents will relieve symptoms as far as chest pain and chest tightness. And a lot of times if you have an aggressive cardiac heart factor like a lipoprotein A, you will plug those stents right back up and have the same symptoms. And Dr. Wolfson actually mentioned something very interesting in that chapter as well too. The more the artery is blocked, the less likely it is to cause heart damage because the blockage is considered stable, which I found that was pretty interesting. Bypass surgery. Coronary artery bypass graft surgery is the granddaddy of them all. This abuse procedure takes place hundreds of thousands of times per year, usually unnecessarily. We have known for years that open heart surgery should only be done in a few cases, but surgery pays a fortune. These are the words of another cardiologist. I'm not telling you this, he's telling you this. The CAS trial, let's go a little bit deeper on this. Researchers took a group of patients with cardiac symptoms along with significant heart disease and divided them into two groups, those who had surgery and those without surgery. In this breakthrough study, the only individuals with improved life expectancy from surgery were those with left main disease or multiple vessel disease, multivessel disease with ventricular dysfunction. So, we'll look at a heart here. He's talking about the left main vessel here. These are the only ones who really benefit from having a bypass surgery. And he says the left main supplies most of the heart. Not very common to have the left main blockage. His advice, consider stent or surgery for left main, otherwise nutrition first. Ablation is another procedure here. For AFib, ablation is 50% effective at best and often requires a second procedure. Ablations are used to treat some abnormal fast heart rhythms which can often be treated naturally. Ablation involves the burning of heart tissue. Now, fast heart rhythms, in and out heart rhythms, a ton of these respond great to nutrition. Like I said, we treat a ton of these throughout the week at the office with simple nutritional protocols. I've actually seen some great ablation procedures done with some patients that didn't respond with the nutritional regimen. And what kind of happens is there's extra electrical areas in the heart where it's signaling the heart to fire more, and they're going in there kind of trying to zap those extra stray beats and get the rhythm back in normal level there. But like I said, nutrition first. Defibrillators. Patients with below normal heart function, studies conclude defibrillators decrease the chance of dying by 7% over 5 years. In other words, 14 people get a device to save one life over 5 years. 13 people derive no benefit, yet get all the risk. All the risk of death, respiratory failure, and cardiac tamponade. And sometimes these units have to be replaced as well too, so you get the probability of infection and things as well too. You can't go in the hospital for simple procedures today without the risk of all these super bug infections. It's unbelievable the amount of things that people are catching, and you do not want to be in a hospital today. EKG. Electrocardiograms are very inexpensive and does not put the patient at any risk. It is nice to check a baseline ECG to use for future comparison in case something happens and you wind up in an emergency room. So between an EKG and a stress test, two very beneficial things to kind of check a baseline component as far as your heart goes. No chemical stress test, a regular stress test, and an EKG. Dr. Wolfson's top 20 supplements. Multivitamin, green powders, chlorella, omega-3s, your K, E, C, D, B, D, O, R, berberine. These are all great things. You want to use things at the right component. We have all these things at the office. Assessing your cardiac function, looking at the right blood panels, knowing your factors, and playing the right supplements at the right doses. There is a lot in this book that I could not get to. He talks about heavy metal issues. Yes, aluminum, lead, mercury, all those issues will create problems with the heart. Cadmium, lead, that will drive up people's blood pressure. Pesticides, toxic components. Exercise, you think that's important for the heart? Your heart's a muscle and you want to exercise. You will strengthen your heart with exercise because your heart is a muscle. Chiropractic, absolutely get adjustment. All your nerves throughout your body control everything. You get well adjusted and it helps everything. I've gone through this entire lecture here without talking about my son. I guess I'll have to save the best for last. This is his first Christmas here, and he's all bundled up here in New Year's in Chicago. There was pretty cold on New Year's there, so he's having a blast, and he came to visit me the other week at the office. One of the patients got me this year, said my daddy can adjust you, so I figured I had to throw that in here. For those of you who enjoy doing the Asiras, we got those up and running back at the office there. Food research, standard process by X research. We use what we get the best results with. We don't put everyone on the same cookie cutter regimen. Depending what we're treating and what cardiac factors we're going after, we're going to put you on a very specific regimen. Like I have 5 heart patients in 5 different rooms. I'm going to treat them all differently because not every 2 people are the same, and these aren't lipid deficiencies. Ordering through the office, free shipping on orders over 125. These are my previous lectures that you can find on YouTube here. Thank you guys for coming out tonight.